My name is Johnny Christopher Walters, and I am an online student from Brigham Young University, Idaho. I am presently doing a certificate in Community Health Program Planning and Implementation. I am talking about Lassa fever prevalence in Kenema district, Sierra Leone. Lassa fever is an acute, sometimes severe hemorrhagic infection caused by the Lassa virus and transmitted by the multi-mammate rat Mastomys natalensis. It is endemic in parts of West Africa, including the eastern parts of Sierra Leone. There is little ecology, social distribution, and determinants of Lassa virus transmission. Yet the impact of Lassa fever add significantly to the health burdens, poverty, and vulnerabilities faced by people in these regions. Lassa fever is a zoonosis caused by Lassa virus. Estimates of its incidence vary widely and range from 100,000 to nearly 13 million infections and between 67,000 deaths each year across West Africa. The primary transmission of Lassa virus to humans is through contact with Mastomys natalensis, one of the most widespread native rodents in Africa. Secondary person-to-person transmission occurs through contact with the body fluids of an infected person. Rodent-to-rodent transmission is responsible for maintenance of Lassa virus as humans are dead-end incidental hosts. Lassa fever manifests itself from 3 to 21 days after exposure to the virus with gradual onset of fever, headache, malaise, and weakness. The lack of distinctive symptoms from other endemic diseases in the region, such as malaria and typhoid, make clinical diagnosis difficult without laboratory confirmation. Deaths occur 10 to 14 days after the onset of symptoms, but evidence suggests that mild or asthmatic disease also exists. Treatment is with ribavirin, a broad-spectrum antiviral. No vaccine is approved for Lassa fever infection. The Netherlands International Health Regulations, IHR, national focal point informed WHO about an imported case of Lassa fever from Sierra Leone. The patient was a male doctor, a Dutch national who worked in a rural Masanga hospital in Sierra Leone. The probable route of transmission is believed to be through surgical procedure he performed on two patients in Masanga Hospital in November 2019. Both surgical patients were considered probable cases, and one of the patients died and he was considered the index case. It is now imperative on all health organizations, including the WHO and CDC, to pay much attention to Lassa infection in order to save humanity. I want to thank everyone for listening.